Out of 18 patients, I saw 12 with some sort of cough, cold, runny nose, that kind of combination of symptoms. And only one of those needed an active intervention from me. So this begs the question, when do you actually need to see a doctor if you're feeling under the weather and run down? Well, the first thing is if you've got a cold, cough, runny nose, feeling really congested up here, chances are the infection is going to be viral. Whether you're having fevers, shiver, shakes and chills, that's all kind of part of this infective process. And you're not coughing up blood or losing weight or things like that. If you're able to tolerate fluids, which is the main thing, eating less food or bits and bobs is fine. That's just part of being unwell. And you're able to bring your temperatures down with paracetamol or ibuprofen, then you can probably try and wait it out for a little while. If you're feeling really unwell and you just can't cope, obviously just go and see a doctor. But generally speaking, most people, this process will take 7, 10, 14 days before you get back to baseline. Now, lots of people will have fevers for the first 2 or 3 days and the fevers stop. If the fevers have stopped, but then your cough gets worse, as long as your fever's improved and you're feeling better, having a worsening cough isn't necessarily an indication that you need antibiotics. Actually, when you get this inflammation in your upper airways, like in your trachea, your bronchi, and up in your nose and your nasal passageways, then that mucus and inflammation has to go somewhere. So as you start improving, that mucus starts loosening, and that's when you get this chesty or rattly cough. And that mucus, you spit some of it out, you swallow some of it, and your body reabsorbs some of it. And that whole process is part of you getting better, even though the cough might feel like it's getting worse or it's gone down into your chest. So the most important thing is, are the symptoms starting to improve? So are you now no longer having fevers, shiver, shakes and chills? Are you able to drink and eat more than you were a few days ago? Are you now able to go about your daily activities a bit more? Are you able to get out of bed, walk around, go outside, go to the shops? Things like that. Those are all signs that you're improving. And if that is happening despite a worsening cough over the course of 4, 7, 10 days, we wouldn't necessarily give antibiotics, we wouldn't necessarily do anything else. But obviously, if you're worried, just go and see a doctor.